Today we go to physical examinations for blood vessels. Peripheral Vascular System. Basically, we're talking about blood vessels in the terminal, mainly in the limbs, the arms, or maybe the feet. We're talking. So we know blood, like circulation all over the body, their function, sending oxygen, sending nutrition to all of the bodies, and the body needs the oxygen and nutrition for their functions. If no oxygen, no nutrition sending, like to the hand or to the feet, the cells will be dying. So that's mainly we're talking about here. So that's in these chapters, mainly we're talking about blood supply go to terminal, and if they are not got enough supply to the terminal, what's the situation maybe happens. So that's the artery we're talking about in the terminal area. So this side certainly is the arm. We have big artery coming from under axillary area, that's the axillary artery. Then the artery changing the name. On the upper arm, they changing the name, bronchial artery. So basic name coming from locally, bone's name and muscle's name. Then in the eyeball area, they have bunching here. One go to middle side, one go to lateral side. Middle side is the ulnar artery, still the same with bone's name. And the lateral side is the radiate artery, the same like a bone's name. Then go to hand. They form an arch, they connect each other. Then go to each of the fingers. So that's in the arm part. Then in the leg part, in the leg part, we're just talking about some big artery here. So we have a femoral artery coming from like an abdominal area, kind of connected there. And then go downwards and passing the knee. And still bunching two of them. One is on the anterior of the legs. One is on the posterior of the legs. So that's on the legs, how artery they pass through. And the blood vessels also including the vein. So the vein here, let's see. The ven's problems normally caused on the legs, usually not caused on the arm. So that's why I didn't put the arms veins in here. I only put the legs view here. So we can see this side, we're looking for the vein from anterior and posterior. So we have a big vein, femoral vein, and go down. Thus go to anterior part. And one branch coming out, go to posterior part. That's basically our superficial view here. So if you're looking from the side, that's go to anterior part vein. That's go to posterior part. That's the superficial view. But we still have a deeper view. Go to kind of center of the legs. And they are communicated with the superficial view. So that's basically the vein in our leg. So if blood vessels have some troubles, including the artery, including the vein, what's the common symptoms? Blood losing supply. So some common symptoms is the pain. Painful circulation will be happens. Certainly possible happens in the arms or maybe happens in the leg. It's depending where it is. And another symptoms, intermittent. That's the special words people walking. Like one side of the leg is shorter, another side is longer. So that kind of people, when they're walking, truly we can see it. Truly we can see the difference. But this kind of patient cause this problem. It's not because two legs is not the same longer. It's because one side of leg is painful in there. They couldn't touch it too long. So this short time touching the earth or floor, and then they move into other legs pretty faster. So that's got that kind of symptom or signs there. So that's another symptom for this kind of situation. And then cold. Cold. People feel cold. And especially locally, cold limbs. We know blood vessels sending blood to the local leg. If sending blood decrease, certainly they don't have enough, like blood go to local leg, couldn't warm it. And also not enough oxygen, not enough nutrition. Patient will feel numbness of the limbs, and also pale color. Still not enough blood go to local leg, and not enough red blood cell and hemoglobin in there. So that's originally our blood color coming from. And hair loss, poor nutrition. So that's some symptoms, relationship and also color changing in the fingertip or toes. Especially happens in the cold weather. Because their blood supply go to terminal area is less already. They may got a pale color in there already. And then in cold weather, cause the blood vessels contractions. Even less blood sending to the terminal area of the fingers or toes. So that's the color changing possible from the pale color changing to blue or even purple. So that kind of color changing, blue or purple color. Like for TCM, we talked about cold can cause the blood stasis. Truly, purple color is the blood stasis kind of color. And then can swollen. Swollen in the calves, legs, feet, basically lower part of the body. So we say blood supply, artery go sending nutrition to the locally, like a capillary in there, and then vein return back, kind of circulation in there. These kind of problems, like swollen, usually caused by vein, and also we talk about lymphocytes. Lymphocytes kind of blocking. We couldn't say totally blocking, but part of blocking is possible cause the water retention locally. Water couldn't totally return back. So that's basically swollen in there. And also locally possible swollen with some redness or tenderness. That's possible some blocking circulation and also cause some inflammation, local painful circulation. So that's some basically symptoms, relationship with blood circulation. So when we're talking other part of the body, we're talking about we have 4 ways for examination. Certainly inspection and palpation and percussion and aspiration. But checking for the blood vessels problems, basically we only use 2 ways. Inspection and palpation. Inspection means we looking. Palpation, we feel it. So that's for blood vessels, we especially checking it. So we mainly checking for the arm and the leg. So let's talk about the arm first. So we inspection first. Inspection. So basically we're looking for the size. Both sides, the size will be the same. If one side is smaller or bigger, so we compare with normal people, that must be that side have some trouble. And we also looking for skin color. So different people normally skin color may be a little bit different. So basically we still compare. Like we can compare both sides. We can compare the arm skin color with body skin color. It should be not big difference. Yeah, maybe still little bit different, but will be not big difference. And then we checking for the pulse. So we can check in radiate pulse in the radial side of the arms. And we can check in the bronchi pulse in the upper arms. And we also can check in about ulnar pulse in the ulnar side. So we feel pulse. So normally blood vessel sending blood to the pulse area. When we check it, we can feel the pulse. But if some blocking in that area, maybe we are a little bit hard to feel the pulse. So that's we looking and palpation. So mainly palpation for the pulse. So we're talking about pulse here, means arteries jumping. So all over the body, we are not only can feel the pulse or arteries jumping in the vast area. We can feel in lot of precision. Like the chart, we're talking about artery passing area. We can find the pulse. And we're also looking if edema is somewhere. Edema's problems for West medicine. We have organ problems can cause, and we also blood vessels problems can cause. Certainly, we need to figure out what's causing edema. But truly, blood vessels disorder can cause edema. We still say artery sending blood go to the local tissue capillary area. What's inside blood? Most part is the water, is the liquid, blood plasma. And then they return back. Part of them return back from the vein, another part from the lymphocyte. So that's any of them have some trouble will cause the edema locally. So edema usually not caused by arteries problems, but it is possible caused by veins problems or lymph problems. So with infections in the arm part, we looking from the fingers to the shoulders. We looking the sides. We looking both sides the same. And we looking if swollen is somewhere. And sometimes we can see the vein. We see if the vein have some changes. And also we looking the color of the skin. And the new bag. That's the easy part. We can see the blood vessels. And also temperature of the skin. Because skin have the blood nutrition sending there, the skin will be moistened looser. But if not nutrition sending there, skin will be dry, sometimes even cracked. So that's the inspection part. Then we're talking about the palpation. Palpation mainly for the pulse. We say we follow the blood flowing. On the radial side, you can feel it. On the ulnar side, you still can feel it. And we also compare the pulse on both sides. It should be pretty similar. If one side pretty strong, another side pretty weaker, that must be on the weaker side. They have some blood supply problems. So that's generally with examinations. We're talking about the arm. Then we're talking about the legs. Legs is still similar like the arm. We're still looking the size of the leg. Should be normal size. So sometimes some people have severe kind of condition. One side is pretty bigger. Another side is normal. That's postural height. That's postural height. Certainly, when we compare, we immediately can find one side is abnormal. And we also still looking for skin color. Skin color should be light bit pink color. For most people. Certainly, the natural color may be light bit different, but they should be moistened looser with their natural color. And then we still feel the pulse, femoral pulse. Pulse should be jumping there. And we also feel the lymph nodules. If lymph nodules have some trouble. So truly, some people have big lymph nodules blocking this area. And the lymph flowing is blocking there, and they can get swollen, big leg like this. So that's why we feel the lymph nodules. And we can feel the pulse in different locations because the blood vessels passing there. And we're still looking for the edema to see blood supply or blood circulation if they have some trouble. So we still go to some detail for the arms. So pretty similar, like we talked about, compare both sides. The size, both sides the same, unswollen, and we're looking for the blood vessels with pattern there, and the color of the skin, and the new band, and the texture of the skin, and the palpation for the pulse. So let's see some pictures here. So this picture, we're checking for the pulse. We feel the pulse. So that's the normal location we're checking for the pulse, or common location we're checking for the pulse. Even for TCM, that's the same location we're checking for the pulse. So we should feel the pulse in there. Certainly, some people's pulse may be a little bit weaker. Other people's pulse a little bit stronger. But whatever, we should feel the pulse in that area. But for some, like reasons or for some illness, we may be hardly to feel the pulse. So in this kind of condition, means the blood supply is blocking here by some sick or illness. Patient maybe feel numbness in the hand or even painful in the hand. And we have typically symptoms or illness we call Raynaud's disease. So this kind of illness is caused by blood supply. For some reason, it's blocking. So usually, if you're checking the pulse, you still can feel the pulse. But the small artery on the hand part, like after passing the pulse, usually pulse part, may be spasming in it. What means spasm? The artery contractions. So that's like a normal artery there. Smooth muscles around the artery. And when the muscle contracted, we know it's getting shorter. So if I make a circle shorter, that means diameter will be smaller. So that happens for this kind of patient. The big artery here, no problem. But the small artery on the hand part, they will spasm or contraction. So that means the blood supply will be less for the hand. So you can see the picture here. The hand pale, even pale in the fingers. And also the color, some part of hand color go to dark red or light bit purple here. So that's basically not enough blood supply and cause the patient's problem. And the patient also feel the hand painful. So that's one illness caused by blood supply disorders. And we also can feel, bronchial pulse. Especially you're thinking about patients have some arteries or blood supply problems. You are hard to feel the pulse in the west area. You go to the bronchial pulse. That's the same location when we test for blood pressure. We put the blood pressure meter banding in that area. Then we feel the pulse. Then we put the scalp in there, and we hear the sounds coming from the scalp. So that we flexion the patient's elbow slightly, and then put the finger there. And the pressure, we can feel the pulse. It's let me go to middle side of the bronchi tendon. So that's the location. So that area, everybody should be feel the pulse. Everybody should be feel the pulse. So certainly, if we couldn't feel the pulse in this area, because that's the big pulse in that area, the patient must have some symptoms or signs on the front arm and hand. So that's the big pulse location. But when we feel the pulse, we need passing a little bit deeper because the artery travels in the deeper part of the body. Especially people have big muscles there. You need pushing a little bit deeper, then you can feel the pulse. If you couldn't feel the pulse in that area, you can move in left side or middle side or lateral side a little bit. It must be everybody have the pulse there. Just the way you feel it. If patient no pulse in that area, it's very, very severe kind of problem. They must have some symptoms. So that's the arm part we're talking about. We finished talking about the arm. Now we continue talking about the leg. So legs still the similar. We still mainly inspections. But when we checking for the legs, the patient should be laid down. Because when they lay down and their muscles more relaxing and they are easily to checking. So that's basically. And then we inspect it. We can cover some genital area, but we expect it to look in the leg fully. So inspection both legs. So the whole leg from the body to the feet. What are we looking for? The size. Size. And both sides, the size should be the same. Symmetry. That means the same. And to look if there are any swollen in some part, or maybe in part of the leg, or maybe one side of the leg. Then we're looking for the vein. And looking if the vein getting enlarged. And also we're looking for some part of the skin if they have special kind of color there. Pigment. That means special kind of color. Sometimes yellow, sometimes blue. Maybe some special kind of pigment in it. And also if they have some rashes in some area. Or maybe scar tissue somewhere and ulcers. So we're looking how the skin conditions. So basically these conditions some of them relationship with blood supply, and some of them may be caused by other reasons. We looking the problem first, then we looking for the reasons. Like a truly blood supply disorder can cause ulcers. And we're still talking about the color and the texture of the skin. So whatever the different people, their natural color in there should be moistened and loosened. If losing blood supply, their skin will be pretty dry, sometimes quick, and sometimes color changing. Like we say, kind of dark red color or purple color in there. And what kind of patient, their skin color is different, but their neophyte color should be let be red color in there. So that's for special kind of people, their skin color is too darker, they are hard to see. We can see the color of the neophyte area, and then to see what kind of color it is. So normally, let it be red color or pink color in there, because blood supply go to there. And also we're looking for the body hair. So that hair here means body hair. So body hair in the lower leg, both sides should be the normal. If some part especially loosey, it must be have some disorder in there. And also the body hair go to the feet and the toe. So we still compare both sides. It should be normal and the same. So that's generally we expect for the leg. And then we talking about palpation. So palpation still for the pulse. We say pulse coming from the artery jumping. Thus blood circulation or blood supply go to the local area. The first bigger pulse, femoral pulse. So thus we can see the femoral pulse in here. I think we can go back to first picture, and we can see the whole body. Then we are more clear for the femoral pulse. So that's the picture. Take out from here. So that's the femoral pulse. That's our hip bone. Basically, like this shape here. Yeah. ASI, that's the bump here. And that's the femoral pulse. Just like in the beginning part of the leg, the beginning part of the leg. So if you put your finger there, you will feel the pulse. So that's we say femoral pulse. We can feel it. We can feel it. So remember the location here. Then we get it bigger. Yeah, this is like the last picture. We get it bigger here. So that's the bone still in here. Hip bone still in here. ASI still in this area. So that's the femoral pulse location. And in the middle side, in the middle side is the femoral vein. So that's basically the location. But the pulse travel more deeply compared with the vein. So thus we can feel the pulse, but we need the pressure deeply. Below that kind of ligaments, about like halfway between ASIS and the Sweartz pupil stone. So that we make halfway here. Both should be like this. About halfway between here and here. ASIS and simple process pupils. So this connected part here. So that's basically, and the deep pressure, you can use two hands pressure together. One over it. That's just talking about palpation technique. You can see like from the video. We have another video later. How they specially palpation for the pulse. So especially patient got much bigger body weight in there, overweight or opposite. So that kind of patient, you need pushing pretty deeply. Otherwise, you couldn't find the pulse there. But still, everybody should have this pulse. If patient know any kind of symptoms in this leg, and you couldn't find pulse, means you are not deeper enough. Certainly, patient like a whole leg have some issue. There may pulse blocking here, but remember, this pulse is pretty bigger pulse. Usually, it's not people truly blocking here. Blocking here causes severe kind of problems. So if you not find it, maybe you are just not deep enough, or maybe you are not in the right location, but you should find it, this pulse. So that's a pretty big pulse in there, Then we're talking about, we try to find another pulse. So that's basically location. We're talking about knee flexion. So we're still talking about where is it located. So now we're talking about the pulse here. Basically behind the knee. Basically behind the knee. And the artery still deeper there. We can find it, but still deep pressure. So that's for this pulse. So this pulse needs slightly flexed, and relax the leg certainly. And then our fingers, use all the finger taps, and then putting behind the knee, middle line behind the knee. And the deep pressure there. So that's look like exactly the location or point blood flow. So in other words, if your needle bladder faulty so deeper, maybe it causes bleeding. But if you clinically try to treat some heat symptoms, you bleeding it, you can go to blood faulty. So everything have two aspects. So in there you can feel the pulse. So we say the pulse in there usually compared with other pulses, they are more difficult to find. Just because it is more deeper. But still possible to find it. Just try to push it more deeply, then we can find it. So that's another pulse in the leg. Then we feel the pulse on the feet. So those sides of the feet, not go to the ankle, let it be low below the ankle, and then we can feel the pulse. So basically, this pulse is pretty close or poised stomach 42. So that's our pulse location. Then put your finger there. You can find the pulse. So this pulse is not too deep. Compared with other pulse. It is not too deep. So truly, if you go to the right location, you should find it. So that's the pulse on the feet. On the feet part, we can find a lot of pulse here. Another one. Postural tubular pulse. So that's basically on the middle side of the feet. We say put a finger slightly below the medulla mandible, middle side of the mandible bone. So basically we have big bone here. Pretty close or poised kidney 3. On the ankle area. So still need pushing little bit deeper or pushing little bit harder. So that you can find the pulse. Some people maybe little bit find the pulse, especially patients have edema in the ankle area. So that's why sometimes if you needle kidney 3, you put the needle there. Sometimes you can see the needle jumping or moving height of the needle because we have an artery there. And follow the arteries like jumping, they can make the needle little bit moving. So if you see these kind of conditions, basically you can just leave the needle there, but not manipulation too much, because it means the needle pretty close to the pulse. So usually our needle is not easily through the artery. Usually it's pretty close, even through the artery. So basically, if you are not manipulation too much, still okay there. But when you withdraw the needles, with the cotton ball and the pressure a little bit longer, still preventing bleeding. So that's another pulse. You can feel it on the feet. Then we're checking for edema. So edema, especially we're talking about PT edema. What means PT edema? Patient have swollen feet there, and you put your finger there for a little bit short time, and then you remove your fingers. But on the feet area, they still have like a mark in there. So that kind of edema we call PT edema. It's not totally disappeared. We also have some other edema. You looking swollen there, and then you put your finger there. But after you remove your fingers, like a local skin, recover. That kind of edema we're talking about no PT edema. So PT edema basically caused by water retention between the cells and the cells. So like we have more water between the cells and the cells. When you put your finger there, so that you're moving the fluid go to side, and they are not immediately coming back. So that kind of edema belongs to PT edema. No PT edema, basically the cells swollen, more liquid inside the cells. So whatever you put a finger there and you remove your fingers, they still swollen inside the cells. So that's by Western medicine we're talking about the edema, edema, PT edema, and no PT edema. For TTM, PT edema usually caused by young disease. And no PT edema, usually caused by key stagnation. So that's some difference here. So now we say we're checking for PT edema. Put the finger there. Put the finger there. Basically like the thumb there. Pushing gradually getting a little bit harder. And putting there about 5 seconds. It's not 5 minutes. Just 5 seconds. You can put like 5 seconds or maybe 10 seconds, but not necessarily too long. And then you remove your fingers. And to see if you still some mark in that area. If in that area, means patient have PT edema. If no mark in there, it's no PT, but still possible, no PT edema. So the location, both sides, dorsum of the feet, just like the picture here, but both sides. And also behind the inside of middle malleolus, like we find the pulse in last pictures, and can over the size area. So basically, we're looking for the PT there. So that's basically after you remove your fingers, you still can see a mark in there from the your thumb there. So we say normally should be no PT edema in there. So that's basically we're checking for the edema, especially for PT edema. And the PT edema, we can recover it for different degree. No PT edema is like a 0. And the most severe, 1, 2, 3. So this picture here basically means let it be severe canal edema. We have 4 even. So this one, still we put our thumb there and pushing about 5 seconds. Then we remove our thumb. Then we still can see the mark there and a little bit deeper there. So that's we say 3 positive PT edema. So we're checking for edema, and we find the edema. Then we find the reason caused the edema. So what's the reason? We say edema basically have a lot of reasons. We possible have organs disorder. Provides the medicine. Organs disorder relationship with 3 organs. One is the heart. One is the liver. One is the kidney. For TTM, little bit different. TTM still have organs disorder, cause edema, but the organ little bit different. We still have kidney, but we're thinking about a little bit more about the spleen and the lung. Water disorder, water retention. For TTM, we have 3 organ relationships. Provides the medicine. We still have 3 organ relationship, but it is different organs. So that's organs edema. And then another reason causes edema is the blood circulation or blood vessels disorder. So right now, we're especially talking about blood vessels disorder, toxic edema. We are not truly talking about organ edema here, but truly organ problems still possible cause edema. So we say right now we're just talking about the peripheral vascular system, or other words, blood vessels cause edema here. So blood vessel cause edema. Recently, deep veins have some blood stasis in there. So that's the medical word means some blood stasis right inside the blood vessels, and then blocking the blood flowing. And another reason, chronic disorder. Still veins problems. Still some blood stasis in there. So when we're looking especially in the leg area, we say we have superficial vein, we have deeper vein. So that's the leg area. So they are communicating each other. So basically, patient have some trouble in the deeper vein here. It will be blocking blood flowing back, certainly. Normally it's blood flowing back. And they may cause the edema in the leg. And when they blocking there, so basically two reasons can cause, like a patient has some blood system disorder, and form some blocking inside the blood vessels. That's my reason. Another possible, we know inside of vein they have valves also, pretty similar like inside the heart. Inside the heart, we have 4 valves. Inside the vein and the lymph, we still have valves. So these valve functions pretty similar like inside of the heart, the chambers. We say the valves keep the blood flowing, go to one direction, especially in the leg area. Like water go upward is more difficult, but they are easily flowing down. What will be happens if without valves? They may up or down, not too many blood return back to the heart. But with the valves, that we say look like a one-way door. When muscles contract, so basically the blood return back to the heart by the muscles contraction. Like people walking, they moving the muscles in the leg area, and they pushing the blood go upward. But when muscles relaxing, look like the water or blood easily coming back. The valves closed here. So it couldn't return back. So that's keep blood contraction go upward, and then another muscle contractions make the blood go upward. and finally return back to the heart. So thus another situation possible happens. Patient have valve troubles. Their valves couldn't totally close. So that means some blood go upward and part of them return back. And repeatedly. So that's another reason cause the problem. So that means not enough blood can return back to the heart. That can cause the local edema or low leg edema also. So that's the second reason. So still the vein, because some thick vein in there, some blood stasis in there, blocking the blood flowing back, or maybe because the vein have some trouble there. So that's possible cause. And another edema is caused by lymph systems blocking. Lymph edema. So that we always talking about blood coming from the artery, but return back we have two ways. One way is vein. Another way is the lymph. So whatever vein block or lymph block, they will cause the problems, like blood couldn't return back to the heart, and especially the liquid part, because inside the blood mainly is the liquid, blood plasma. So mainly the liquid part couldn't return back to the heart. So that's cause the water retention. Water retention in the local way. That's we say that's the edema. So just like the water. Water coming and goes. Like raining. Right now it's raining day. Always raining. And we can see a lot of water in the like a street, in the road. Truly, some water coming, and then from the draining, they will go away. But if the draining blocking there, more water will be in the street. So that's pretty similar like our edema. We should keep the balance. How many coming, how many go away. If they are not go away, they will cause edema. And also we say we're looking for the skin inspections for the color changing. So what kind of color changing? Usually we can find it. Usually sometimes it's red kind of color. And we also pay attention to feel it. The temperature is cold or warm. Try to feel the body temperature and try to feel the veins there. So basically, if you feel some pretty hard pain there, that's basically some blood stasis inside the vein in that area. So that's basically from the color, from the temperature, or maybe we can feel some hardness of the vein. Then we know local blood circulation disorder. And also sometimes we can find some brownish kind of color, usually around the ankle. Still poor blood circulation in that area. And some ulcers. Ulcers forms in the skin. Still poor blood supply. Not enough nutrition and not enough oxygen. Certainly we are talking about here, we're talking about internal disorder caused ulcers. We are not truly talking about like people injured or trauma after still postal some ulcers in there. So patient no trauma, no injury, but in their skin there are some ulcers in there. Most case blood supply disorder. We know some people have diabetes. Diabetes kind of patient, because their blood sugar level pretty high, they are pretty damaged blood vessels. When they damage blood vessels, they are pretty easily caused lot of problems, like people get eyes problems, and also patients easily get infections, like in the skin, and easily get ulcers in the skin, because the blood supply is kind of blocking, and the skin losing nutrition, and also the blood sugar levels pretty high. It's easy get the infections. So if they have ulcers in skin, they are pretty difficult to heal. So long-term chronic ulcers in the limbs, that's pretty common for some diabetes kind of patients, if their blood sugar level is not be controlled. And also sometimes we can find pretty rough, dry, and thickness of the skin, still can caused by blood supply disorder. So some pictures here show you some troubles happens in the leg, especially caused by blood vessels disorder. So this one is the veins problem, chronic veins problem. The leg got swollen. Yes, certainly it's swollen leg in there. And we can see some enlarging superficial vein. A lot of area. So basically this kind of disorder is caused by people we talking about deep part of veins blocking. Maybe blood vessels problems, maybe valves problems. So blood couldn't return back to the heart from the deeper vein. So then they go to the superficial vein. So just like we have picture before. Yeah, just like a picture here, we say normally these deeper veins bring the blood back And these superficial veins still bring the blood back. And they communicate each other. Usually from the superficial vein go to deeper vein, and then go back. So we can think about something happening here, blocking the blood supply. So the blood coming from here, they couldn't pass in, and also coming here couldn't pass in. So what will be happen? So basically all the blood will go to superficial, go to this way, and try to return back. So that's why got a swollen vein there. Certainly, if they happens in the lower part of the leg, we still have some community on the lower part of the leg. They will got a bigger vein in this area also. So that's usually situation. Like the picture here, yeah. Like the picture here, yeah, we can see swollen veins, superficial veins in here. So this kind of situation, we're talking about blood return back to the heart, mainly is muscles moving or contractions on the leg. So if patient like always standing there, like some teachers or some nurse, they are not truly walking. So that kind of situation, their muscles not contractions, so they are not moving blood go back to the heart, and the blood flowing slower and easily cause the blood stasis inside of the vein and then cause the problems. So that's clinically we can see, and sometimes we ask patients job, special kind of job, they always whole day standing there, they may cause. And they are not only cause the bigger vein, they also can cause some ulcers in the skin. Because the blood not circulation properly, even pupil color in the local skin. Like the blood couldn't return back, like go to the heart. The new blood will not come in. So kind of blood stasis in the local area. Skin pretty dry and dark color and pupil and leaving some ulcers is pretty hard to heal. So that's for these kind of patients' problems. So that's the main problem. And still possible for like some arteries. Yeah. So these are still the main problems. This happens in different areas. So still possible caused by some arteries, but not this picture. So usually they cause the toes problems. That's more terminal area. So blood supply blocking somewhere. So certainly if they blocking, like artery blocking in the upper part, the whole feet or lower leg will have some problem. But usually this small blocking in the toe area, they may cause the toe some dark color and then black color, and the cells totally dead in there. So that's another kind of issue. So whatever artery or veins, they have some trouble. They will cause the problem locally. and usually arteries cause problems. It's more acute, more severe. And veins cause problems. Usually it's chronic problems. It's gradually development. But still, you can see the picture, still it's severe problems in there later. So that's basically for these chapters, we're talking about blood circulation disorder, mainly peripheral vascular system. Means the blood vessels go to the terminal area, like the arm and the leg.